Hello and welcome. Today, we're going to walk through how to solve a real-world issue in pharmaceutical and drug manufacturing, specifically, a CAR-T therapy manufacturing problem, using the ProSolvr application. Here, I'm inside the drugs and pharma system. You'll notice there are already a few collaborators added, and of course, you can add more as needed. Let's begin by creating a new problem. I'll click Add Problem, name it Demo Problem 1. And set the title to CAR-T therapy drug manufacturing problem. Once I save it, I'm taken to the RCA workspace. This workspace opens with a default template for CAR-T therapy drug manufacturing. I can review the details that were captured when the problem was created, edit them, or add new information as needed. Now, this default template is just blank with categories and YYs. Although you can manually fill in the entire fishbone, that process can take a while. A much faster way is to use Browse Templates or Generative AI templates for your RCA. For this demo, I'll browse templates. Our community offers over 300 ready-made RCA templates out of the box to jumpstart your analysis. I'll search for CAR-T therapy, and here's a template that looks relevant. I can preview it, check the description, and it looks like a good match. Let's apply it and include everything. This will overwrite my current RCA template with the community one. ProSolvr is a collaboration tool for joint analysis by your team members, supporting concurrent updates and putting everyone on the same page. Now I'm going to start collaborating with one of the team members, Ron. For example, under Equipment and Manufacturing, I can assign specific causes to people. A right-click opens the menu, or I can use the Assign icon. I'll assign one cause to Ron, and another to myself, Tutorials. The head icon for a cause gets colored blue when someone is assigned. Since Ron is online, he'll start working on his items. I can also leave a note such as, "Hey Ron, this is an urgent issue." You can choose who gets notified, and they'll receive an email immediately. Next, I'll look at raw materials and reagents. This section includes causes such as lot-to-lot variability, inadequate qualification, and variability in serum, cytokines, plasmids, or viral vectors. The folder icon for any cause indicates nested causes. When I open it, I can see all related sub-causes and easily move up and down using the breadcrumbs. This drill-down capability of ProSolvr Fishbones enables in-depth analysis of complex issues while maintaining clarity. We also offer a fault tree analysis view, which presents the same information in a tree format. You can expand or collapse branches, zoom in, zoom out just like in the fishbone. I'll switch back to the fishbone view, since it's generally more convenient to use. Now, let's investigate supplier-related issues. If I find something meaningful while investigating, I can add a clue. For example, lot variability found for supplier X. Clues added to a cause act like evidence and automatically get pinned to that cause, showing a red light bulb. If needed, I can assign other causes to someone else, say, Julie, since complete root cause analysis often requires checking multiple branches and eliminating causes that may have contributed to the problem. Now we can see that Ron has updated several items already, as causes on his branch are colored green. To review the activity stream, I can open the update log, which shows every change, who made it, and when. All updates including notes, edits, assignments are recorded in the log. Next, I'll add an action for my cause. I'll click Add Action and create one under Update Process and note down Refined Supplier Qualification Process. I'll set today's date and save it. Now it appears on the action list where the whole team can see it. There's also an action timeline, a Gantt-style view that shows who performed which actions and when. This is especially useful for problem managers to coordinate actions and track their status. Once I confirm this is a contributing cause, I can mark it accordingly. By opening the menu either through the icon or by right-clicking, I can change the status to contributing cause, which would color it red. The system asks about clues, and since I've already added one, I'll proceed. The red highlight then propagates upward through the branch, showing that we've identified a significant cause in that area. We can continue exploring other branches, or if we're confident that all possibilities have been covered, we can lock the cause analysis. I'll go ahead and lock the RCA analysis. Once locked, no new causes can be added or removed unless the analysis is reopened. However, action items can still be updated. One last step, we can save this solved problem as a RCA template. From the menu, I'll click Save as Template, name it Drug Contamination Template, add a description, select what I want to include, and save it at the system or account or company level. Once saved, I can browse templates and see the new one immediately. I can preview it, edit it, or update the names if needed. This demonstrates how you can collaboratively solve any type of problem within ProSolvr using fishbone and fault tree views, community templates, custom templates, and a structured, AI-powered RCA workflow. And with that, we conclude this demo. Thank you.